We're looking at an anterior view of the right femur. Proximally, we have the head of the femur. This articulates with the acetabulum of the hip bone to form the hip joint. Medially, there's a little indentation. This represents the fovea capitis. Moving slightly distally, we have the neck of the femur. Laterally, there's this large bony projection called the greater trochanter. Medially, we have the lesser trochanter. There's a little line that runs between the two. It's not shown well on the models. It's right here where I have this pointer. This represents the intertrochanteric line. If we look at a posterior view, between the greater and lesser trochanter, posteriorly, there's the intertrochanteric crest. At this crest and line, this is where the capsule of the hip will attach. Back looking at the posterior view, there's this roughened area over here called the gluteal tuberosity that runs from the intertrochanteric crest to the linea aspera. Linea aspera is a ridge that runs along the posterior midline of the femur. As you move distally along the shaft, medially we have the medial epicondyle of the femur, and there's a little bony projection called the adductor tubercle, where part of the adductor magnus muscle attaches. Laterally, we have the lateral epicondyle of the femur. This surface represents the patella surface, where the patella articulates with the distal surface of the femur. Then we have the condyles of the femur. This one here is the medial condyle, and this represents the lateral condyle of the femur. We turn it over. Between those two condyles, in this posterior view, we can see the intercondylar fossa. If we go back and take a look at the anterior view again, if we go to the medial epicondyle, and if we come proximally along the medial aspect of the shaft, this is where the medial supracondylar ridge is. And then, similarly, we look at the lateral epicondyle, move proximally, this is going to be the lateral supracondylar ridge of the femur.